So instead of having to go through middlemen like phone trees, leaving voicemails on mailboxes that might get checked by a nurse or by somebody else. So how can technology change the way healthcare organizations interact with their patients? I think we've talked about this a good bit on the podcast, talk about it a little bit in the book, and have just written about it for a while. But one of the big ways that technology can change the way healthcare organizations interact with their patients is more on a patient clinician side of things, where the access of or the openness of communication between the clinician and the patient is now more streamlined. So instead of having to go through middlemen like phone trees, leaving voicemails on mailboxes that might get checked by a nurse or by somebody else, using something like secure messaging or a patient portal or secure text messages, something of that nature, can at least in principle open up and streamline the communication between the clinician and the patient. Now, sure, sometimes the patient is going to shoot a message to a clinician and the clinician is going to be seeing so many patients or something like that, where maybe a nurse or a medical assistant or something like that is triaging the messages and then kind of filtering them through to the clinician. But whatever the case may be, ultimately, if it's done right and the clinician is the one responding or sending some of those messages, what you end up doing is removing kind of the abstraction that takes place in healthcare, where maybe you call your doctor and the nurse says, okay, let me check with the doctor. And she checks with the doctor, takes 3 or 4 hours, and gets back to you and says, oh, well, I talked to the doctor and so, this is what he said. If you can remove that and say, well, why don't I just punch you through? You can shoot a message to your doctor, like a secure message, and he'll respond whenever he's got time. And you get a response that's in the voice and in the person of that clinician, or in this case, the doctor. That does a lot for improving trust, therapeutic alliance, et cetera. So one of the big ways that I see technology reshaping the way that healthcare organizations are interacting with the patients is really just streamlining that communication and kind of removing the middlemen or the barriers that have been set up, sometimes out of necessity because of the way that our healthcare system is run.